Hello, this is our group presentation on strategies for collaboration in healthcare. Our group members include Lakeland Gunter, Jessica Owen, and Maya Tribune. We are part of the School of Nursing MSN program at Arkansas State University. To begin, we'll do an overview of what this presentation entails beginning on the next slide. First, I'm going to introduce interprofessional collaboration, or IPC, as a concept in healthcare. IPC can be defined as a coordinated effort between healthcare professionals along with patients, family members, and communities to deliver high-quality care. This is achieved through shared goals, communication, and role accountability. Collaboration is essential in complex, multidisciplinary healthcare systems. Building on the definition that was provided on the last slide, it's important to remember that IPC is a process that occurs across multiple levels that include the individual, team, and system rather than a single interaction. According to recent evidence, collaboration depends on how healthcare professionals coordinate roles, communicate effectively, and work towards goals in real time. Strong collaboration relies on members of the team continuously adjusting care plans based on patient needs. Now that we understand collaboration as a process, it's important to recognize that collaboration can be aided by structured frameworks such as Team Steps. It was developed by the Agency of Healthcare Research and Quality and focuses on communication tools, leadership, and situation monitoring to improve team performance. Collaboration is structured and can be measured. It is a teachable skill that is not always inherent and can always be improved upon, and it's vital that all team members put in a conscious effort to improve their communication. We can break collaboration down into its core components, which include communication, mutual trust and respect, role clarity, and shared goals. Each element is interdependent, therefore failure in one can lead to a breakdown in team functioning. Unclear roles and poor communication are the most common barriers in healthcare networks. Finally, when we look at collaboration from a systems level, we can recognize that healthcare systems are interconnected networks where collaboration links different providers and services. Effective IPC reduces risks of overlapping services and improves coordination across the healthcare setting. Boutin found that collaboration strengthens continuity and integration of care, particularly in complex patient populations.
Studies have shown that collaborative care models can lead to better patient outcomes, reduce hospital readmissions, and improve overall health management. Collaborative care encourages ongoing learning and knowledge exchange among healthcare professionals. This promotes a culture of continuous improvement and professional growth. APNs play a central role in collaborative care models, acting as pivotal members of interprofessional teams. Their advanced education, clinical expertise, and patient-centered approach make them valuable assets in providing comprehensive care and coordinating the efforts of the healthcare team. Failure to collaborate in healthcare can result in patient harm. Therefore, organizations and clinicians are obligated to collaborate under the moral requirement to do no harm. According to Tracy and colleagues 2023, the three elements utilized to ensure strong collaboration are effective communication, mutual respect and trust, and shared philosophy of care. Quality patient care requires collaboration because it reinforces commitment to a common goal and it reaffirms the central goal of patient welfare. Collaboration enhances shared knowledge because all healthcare providers repeatedly educate each other about the patient. Collaboration also demonstrates that the manner in which care is delivered is as important as who delivers the care. The evidence that collaboration works has suggested that there are structural and interpersonal dimensions to collaboration. In essence, although institutional policies or standards do not guarantee collaboration, they can establish expectations for collaboration. These institutional expectations can provide a structure that facilitates interpersonal communication and relationship building. The mutual goals of quality patient care and the ethical imperative to collaborate are at the center of interprofessional efforts to provide care or resolve conflicts in approaches to care for patients. Collaboration also plays an important part in evidence-based process. Clark and colleagues 2023 describes results from a broad review and expert feedback that was used to help create guidelines for teaching clinical effectiveness. They found that interprofessional collaboration is essential for successful EBP implementation. Clark and colleagues 2023 also notes that additional studies of nurse practitioners' implementation of EBP identified collaborative practice issues as barriers to EBP implementation, highlighting the importance of collaboration.
Advanced practice nurses often serve as educators, mentors, and leaders, placing them in a key position to implement collaborative practices in both clinical and educational environments. Effective collaboration improves patient safety, strengthens teamwork, and enhances learning environments for nursing students and healthcare professionals. This section focuses on strategies advanced practice nurses can use to develop collaboration within healthcare teams. Advanced practice nurses can actively develop collaboration by implementing communication training, simulation-based learning, interdisciplinary partnerships, and digital communication tools. Nurse educators play a particularly important role in facilitating these strategies within both academic and clinical settings. One strategy for developing collaboration is interprofessional communication training. Workshops and continuing education programs, including multiple healthcare disciplines, allow collaborative communication practice. Research shows that structured communication training improves how healthcare professionals address patient care issues and clinical errors together. Advanced practice nurses can facilitate these learning opportunities to strengthen team communication. Simulation-based learning is another important strategy for developing collaboration. Simulation allows healthcare professionals to practice working together in realistic patient scenarios. Debriefing after simulation encourages reflection and discussion about team communication and performance. Studies have demonstrated that simulation-based interprofessional education improves teamwork and communication among healthcare providers. Nurse educators often design and lead these experiences. Collaboration can also be developed through interdisciplinary partnerships among advanced practice nurses. Faculty collaboration across specialties allows advanced practice nurses to share expertise and develop new teaching approaches. According to Ritchie et al., collaboration among advanced practice nurse faculty improved teaching effectiveness and strengthened professional relationships. Technology also plays an important role in developing collaboration. Digital tools allow healthcare professionals to communicate efficiently and coordinate patient care. Teaching healthcare teams how to effectively use these systems can improve collaboration and information sharing. Let's review what we've learned. Interprofessional collaboration is a coordinated effort among healthcare professionals, patients, and families that includes effective communication, mutual respect, and shared philosophy of care. Advanced practice nurses are pivotal members of the interprofessional team and must practice strong interprofessional collaboration to improve patient care and prevent negative patient outcomes. Collaboration is a teachable skill that advanced practice nurses can develop through communication training, simulation and debriefing, interdisciplinary partnerships, and technology.